working in a health system, we sometimes have to remember that children are not little adults. One size does not fit all. There has to be special training, special expertise, a confidence, and a culture of care that the organization brings to those children and families that can only be provided when the resources and when the organizational commitment is there to care for children.
I'm Chantel Carell. I am the statewide manager of the Anchors Program for Children.
I'm Michael Terhorst. My wife Elizabeth and I had our first daughter Sophia in 2011. Unfortunately, at 6 weeks of age, she was diagnosed with a terminal genetic disease called spinal muscular atrophy.
I'm Brad Hemker. I'm a palliative care physician and have the privilege to work very closely with the pediatric team of Hospice of Michigan and get to see firsthand some of that amazing work that the team does with children and families.
We had twin boys, Maxwell and Wesley, that were born at 24 weeks old. They were very small, about 1.5 pounds. Max was 10 months old before he came home for the first time, and he had a trach and was on a ventilator and required a lot of support at home.
I look back now and seeing what the pediatric program does for families and wish that that had been available to us, because I think it would have made our last journey a lot different in those last few weeks.
As the parent who's going through this, like, your entire world is crumbling. And if you don't have the right kind of care system in totality, it has lasting impact, right? Not only on that experience while the child is with the family, but the impact on the family for generations afterwards.
At that time, there really was not, although we received services from Hospice of Michigan, there was not a dedicated pediatric program. The thing that saved us was we had a wonderful pediatrician, Alan Siegel, who, I mean, he would come over to the house, he would do procedures at the house so we didn't have to go to the hospital. Just an amazing pediatrician that I don't know what we would have done without him.
Sounds like he was working as a hospice doctor basically for you and some of those
Right.
connections, and I think that's what's great about this team as well. Because the goal shouldn't be just simply waiting for the end of one's life. It should be making life as good as possible in the meantime, and that's exactly what hospice is all about.
Having his comfort of his own bed changed something, because within 48 hours of being home, he asked if he could go outside and play, and we kind of looked at each other, are we allowed to let him do that? And Chantel said, you know, if he's doing good in a week, let's talk about a trip. That next weekend, we were in Chicago on the big Ferris wheel and the aquarium and Legos, and we went to his first movie.
And it's just as much about you and Mark and Wes as it was about Max.
The day that Max passed, Mark and I both didn't really think it was gonna be that day. And you kind of knew at that point that was gonna be, we had about 24 hours. We had this whole plan. We were gonna have a sleepover in the family room together, and we were gonna just kind of let Max go. And as we're putting this plan together, Max thought, meh, I'm just gonna do it now and be quiet.
Like he did his whole life.
Yep. He was still in charge though. And I remember the moment it happened, I was calling my brother-in-law, and Mark called me back in, and you took the mask off, but you rubbed his back, and I remember you whispered in his ear, he's already in heaven. And as the night went on, we had our family come, and they all held his hand and said goodbye, and we all just kind of sat there, and Chantel stayed for hours. And you didn't leave until we looked you in the eyes and said we were gonna be okay. And you called first thing the next morning, and I don't know how we would have gone through that day without you. It really really don't. Just knowing that Max was cared for and I could be his mom. But I also had a friend that I adored and loved and trusted, and Wes had someone to give him a hug.
It's putting the child as a child back in charge of their experience versus letting their illness lead the way.
We're in the car.
So I'm just so happy today that we have people like you and Dr. Hemker and your whole team available to help families.
This is really all about courage. I so admire, I'm in awe of the courage that a family has to have when they are caring for a child in end of life. But I also have incredible admiration for the courage of the care team. But it's also about the courage of a community who is able to step forward and say, this is a really difficult conversation. As generous donors, as supporters, as a community of caregivers, they've had the courage to say, this is vitally important work. And we treasure these families and we treasure these children, and we want to support this team of caregivers who is providing this care.